Today, we are talking to my friend and colleague, Dr. Funke Afolabi-Brown. She is a pediatric sleep expert extraordinaire, and she is going to be talking to us today about night terrors, how to handle these in your clinical practice, and also we have an exciting announcement about Dr. Funke's new book, which she's going to tell us all about as well. I'm Dr. Nishi Bhopal. I'm an integrative psychiatrist and sleep medicine physician. This channel is for you, the health practitioner, the physician who wants to learn more about sleep medicine. If that sounds like you, go ahead and subscribe to this channel. And then I also invite you to get my free sleep mini course for healthcare practitioners. You can get that at intrabalance.com/doctors. Okay, let's jump in. Dr. Funke, thank you so much for being here with me today. Can you tell us to our audience, if anyone isn't already familiar with you, you're a very familiar face on this channel, but to anyone who's new to you, can you tell us about yourself and your practice?
Yes, thank you, my dear friend and role model and inspiration, Dr. Bhopal. You just amaze me all the time. Thank you for the work you do within this space. It is so much needed. I know it's a lot of work, but I could tell you're changing lives. So thank you. I just wanted to start with that. My name is Funke Afolabi-Brown. I am a sleep medicine physician. I have expertise in pediatric sleep. And I have a company called Restful Sleep MD. And the mission of that company really is to help individuals improve their sleep. And I do this through different means. I do this through teaching, speaking, and education. I do it through consultation and coaching, as well as my practice, my clinical practice, the Restful Sleep Place, where our focus is really on helping children and young adults achieve optimal health through optimal sleep. And so I do quite a few things, but really that's a brief summary of who I am and what I do. I'm a mom as well, and a wife, and a friend, a sister, and all that good stuff too.
Amazing. And Dr. Funke, you are a role model for me as well. And all the amazing things that you do in the pediatric sleep space, it's so needed because not only is there a shortage of sleep physicians in the US, but there's a significant shortage of pediatric trained sleep doctors. So thank you for all the work that you're doing. And I'm really excited to chat with you about night terrors because I think this is something a lot of parents are seeing in their practice, or parents are seeing in their kids, and then physicians are seeing this in their practice. Whether you're a physician, therapist, or sleep coach, you are likely hearing about this from the patients that you work with or parents of the pediatric kids that you work with. So let's talk about what are night terrors? How do you distinguish them from nightmares versus a confusional arousal versus a nocturnal seizure? What's the difference and how can the practitioner make that
Yeah, I
differentiation?
think that's a great place to start. So, night terrors, confusional arousals, nightmares, and sleepwalking, all of those things fall under the umbrella of what we call parasomnias. And para just means around sleep. So these are just abnormal behaviors or unusual behaviors that are occurring during the sleep period. And so it turns out sometimes people even call, instead of calling them night terrors, they call them sleep terrors because they occur even during some naps as well. So essentially, night terrors or sleep terrors are these episodes that are relatively common in children where they have this intense experience of discomfort. They may sit upright, look like they're wide awake, look like they're seeing some things, intense agitation, distress. They may be crying, they may be screaming, but they typically are in their bed. And it occurs during the first, we usually talk about deep sleep. So the first, usually within the first half of the night, because it's occurring in deep sleep and can be very terrifying for most parents, except the child is completely unaware. In fact, if you try to interrupt and wake up the child or you try to console them, sometimes, and that's part of the things we talk about in recommendations, they actually may do worse. And these episodes last just a few seconds to minutes, but it will feel like a whole long time because it's very stressful. And yeah, so that's something that we see. Now, when a child has this night terror and is displaced, meaning that they get out of their beds, we then call it sleep walking, right? So it becomes not just a sleep terror, it becomes sleepwalking with a sleep terror. How do you differentiate that from nightmares? Because many times people mix it up a lot. I think I'll step back by saying there are a couple of things that happen at different stages of sleep. During slow wave sleep is when we start to see a lot of those parasomnias, a lot of the confusional arousals, the sleep or night terrors, the sleepwalking. We see it during slow wave sleep or deep sleep. Nightmares typically occur during REM sleep, the rapid eye movement sleep, right? That's really what we call dream sleep. So that's when you tend to see more of nightmares. And so that, first of all, differentiates it because typically nightmares will occur more frequently. Of course, never say never, more frequently in the latter part of the night. Sleep terrors will occur more in the earlier part of the night. So that's the timing is one difference. The stage of sleep, typically sleep terrors occur during slow wave sleep. Nightmares occur during REM sleep. So that's the second. The third thing is during sleep terrors, the child is not aware. They're completely unaware. Like the parents are distressed. Everybody is distressed. You're seeing they have tachycardia. The child is looking very uncomfortable, yet they're completely oblivious to this. And in the morning, they usually don't have any recollection of it. Nightmares, on the other hand, the child is typically upset upon awakening. So they're awake to say, I had a nightmare. And they usually will be able to describe what happened. Oh, there was something chasing me. I dreamt I was falling off a cliff. They can actually describe what's going on. But sleep terrors, they're completely unaware of it. The child is coming downstairs, parents were up all night, and they're just like, wait, what happened? So those are some major differences, I would say, in terms of the differences between them.
That's really helpful. And also, selfishly, I'm preparing for boards right now. So I'm using this interview as part of my board
That's
preparation.
awesome.
So thank you for that.
Yeah.
Continuing along those lines, let's say you're a
Mm.
practitioner. I'm a psychiatrist, or maybe there's a primary care doctor, a sleep coach. And so a parent comes to you and says, my kid has these night terrors. You've determined that their night terrors are not nightmares. How do you counsel them? They might ask you, is this something to be worried about? Are these benign? Will they go away on their own? Should I be worried about this? Is there something else I should be looking out for? What should the practitioner be telling?
Great question. One of the things you had also asked me to talk about is confusional arousals because we see that a lot actually. Now, the way that is different, because I get a lot of families mix this up also. In confusional arousals, your child may just sit up, mumble something, and go back to bed. So it is completely, they don't look distressed. They may look confused, right? They may look a little bit disoriented, but you're not getting that increased sort of intense distress that you see in sleep terrors. For confusional arousals, they'll get up, maybe mumble something, and then turn over and keep sleeping. Very common, relatively benign. Nothing is going on with that. Now, in terms of counseling around sleep terrors, one of the things I usually will say is the parent is the one that needs to be calmed down most of the time, right? Because the family is wondering, what is going on? Am I doing something wrong? Is something wrong with my child? Is to say, this child is completely unaware. They look like they're struggling, but they are fine. There's nothing going on. Now, then we have to step back and say, when does it become an issue? If it's occurring frequently, say maybe it's occurring more than 2 or 3 times a week, then you want to say, okay, how much of this is impacting this child's daytime function? How much of it is impacting the family's dynamics? In which case, we want to then talk about what strategies we can use to address them. And if we look and first talk about what triggers them, I think that would also help us to figure out what to do about them. So what's a common trigger is stress. If your child is going through a stressful period, or you are going through a stressful period, or the family is going through a stressful period, that's one. If you have a child who is sick, maybe they have an ear infection or they have an underlying sleep disorder, something like sleep apnea, rest or periodic limb movement index, those things could trigger arousals, and that can actually trigger a sleep terror. If you have a child who is sleep deprived, so short sleep or insufficient sleep syndrome is a very common culprit when it comes to the sleep terrors. And then another time when you'll experience this is if you have a family history. So it actually runs in families. So we take a detailed family history when I see these patients, and they may say, my child, I used to have sleepwalking, and it's any parasomnia. So you might have a parent who's, oh yeah, I used to sleepwalk all the time, and their child has sleep terrors, or vice versa. So there's usually very frequently a family history as well. So I think when you talk through what those kind of risk factors and triggers are, it can help families say, okay, then what are the things we can do, right? Family history is a family history. What are you supposed to do? Most times, I would also say most children outgrow these sleep terrors usually by school age. Very rarely they will progress to adolescence and adulthood, but many times by school age, early school age actually, they outgrow it. So that's also reassuring. And then figuring out how do we address those triggers. So, of course, if you're having this very rhythmic where every single day or every single night this child has it, you do probably want to rule out any underlying sleep disorder. So that might be something, might be worth considering getting a sleep study to rule that out. Very easy or relatively easy fix is what we call sleep extension. So if they're sleep deprived, you want to get more sleep. And what does that look like? It may not be anything like significant, like it may not feel significant to you, but it can make a difference. So adding about 15 minutes or 20 minutes of extra sleep. Usually I would say add it to the beginning of the night because most of these kids probably are not getting enough sleep. Instead of having them go to bed at 9, you can have them go to bed at 8:30. So that's what we call sleep extension, and you build on that gradually. So depending on what the number of hours of sleep they're getting is, you just want to add another buffer of about 30 minutes or so. So for instance, if you have a school age child who's supposed to sleep 9 to 11 hours and they're only getting maybe 8 hours or 7.5 hours, just gradually extend their sleep. Don't try to put them in bed at 7 p.m. if they typically go to bed at 9 p.m. Put them to bed maybe 8:30. Build slowly to increase the amount of sleep they're getting. So that's a big one, and it's a big game changer. And another thing I would say along the same lines is basic healthy sleep habits, right? So limiting caffeine, limiting stimulants, avoiding electronic devices, those things we usually talk about, and we're like, oh yeah, sleep hygiene. It actually plays a big role with these kids. And then finally, if you are noticing, you know that there's a pattern to this. Say, for instance, you're like 11 p.m. like clockwork, or anywhere between 11 p.m. and 11:30. This child, I hear this piercing scream. Everybody runs to their room. You can actually do what we call preemptive wakening. And I detail this extensively in my book as well on how you go about it. But basically, the long and short of it is that you go to the room maybe about 5 to 10 minutes around peri their night terror. So around when you think they're going to have it. So if like 11 p.m., they usually will, then maybe 10:45 or so, just go in there and wake them up gently. Make sure they're fully awake, maybe to use the bathroom, to take a sip of water, and they go back to sleep. So the reason why that is helpful is it's almost as if you're avoiding them getting to that time where they bypassing that cycle pretty much, but bypassing that sleep cycle, and so they restart again. And that's been shown to be effective. I would say you have to be very cautious about this. You don't just do it randomly because we now don't want you to cause insomnia in your child by waking them up all the time, especially if you're noticing that there's a frequency to it and it's occurring like very consistently, like clockwork. That's something that tends to be helpful.
That's so helpful. Thank you, Dr. Funke. You just shared so many pearls of wisdom there. So, just to recap a little bit, one of the common triggers is sleep deprivation, like you were
Mhm.
saying. So, one of the first places to start is the sleep extension, working on sleep hygiene, stress management, and then these kind of preemptive awakenings, as you were discussing. What if the kid doesn't go outgrow this by the time they get to early school age and it persists? Is that of concern? Do you watch and wait, or what's the
Yeah, it's
recommendation?
very important. I think more importantly than anything is number one, if you're noticing that the child still has it, again, I think almost like 5 to 10%, don't quote me on that. I have to look at the recent literature, will persist. And so the key is really figuring out how does it impact them overall, their day-to-day function. Do they have sleepiness during the day? Do they have difficulties with their behavior and things like that? If that's the case, then in some instances, not very frequent, we might try medication management. And not my favorite, honestly, personally, I hardly ever need to do that. We may do like a benzodiazepine, really low dose. But I would say to shy away from that as much as possible, especially if it's not like it's impairing them too much. But really keeping those sleep habits, making sure that they are maintaining that regular sleep wake schedule has been something that I've seen to be a big game changer. If you are in a situation where you haven't gotten a sleep study, that might be a time to also get one to rule it out. And again, it's a lot of reassurance at the end of the day is what families need. I have, and then treating on the line, especially as they get older, they might start to develop comorbid mental health issues. So treating that as well may play a big role in helping these kids.
Great. That's really helpful. And so I'm thinking about if I'm the pediatrician or the psychiatrist and I'm working with this family and now we've got these behavioral
Mm.
interventions in place, we're working on the reassurance, thinking about, okay, maybe we should get a sleep study if these symptoms don't improve. Is there any other workup we should be considering? Are there labs or an EEG or anything else that we should
That's
consider
a
at this
great
point?
question. So there is the sleep related epilepsy or sleep related nocturnal seizures that most are very concerned about when kids have either it's any of the parasomnias, sleep terrors, confusional arousals, sleepwalking. If you're noticing, most people will say stereotypical, maybe like tongue, lip smacking, or they're writhing their hands in a certain way, or doing things that are seem really stereotypical. I think in those situations, you absolutely should get a sleep study, regardless of the frequency, because that's really important to rule out a nocturnal seizure. The sleep study you get is not just your typical PSG. It definitely has to be in lab, so not a home sleep test in that case. We usually will say we do the extended seizure montage with those sleep studies. So you're maybe working with a neurologist, a sleep neurologist as well, to make sure that we're capturing a lot more data on their EEG. And then you can then see, because if they do have nocturnal seizures, then that's a whole evaluation on the side that needs to be done. They may need scans to make sure there's no brain tumor or any other thing that's going on. So that sort of takes you to a whole different path now. So I think that's something that you absolutely want to rule out. In terms of blood, it all depends. I think this is where taking a very detailed history comes in. If you're hearing symptoms like, oh, they have super restless sleep as well as these episodes, or they have difficulties going to bed at night because they have discomfort in their legs or parts of their body, then we might look for ferritin deficiency. And actually, I think there have been a few of my patients that have actually gotten that because I was just like at a loss, and the parents and the child was really struggling, and they had really low iron. So, restless sleep disorder, restless leg syndrome, periodic limb movement disorder, those are things that we would want to evaluate for. In children, one of the most common reasons is low ferritin. So, we would check that, supplement them. Usually, I aim towards 50 to 75 nanograms per DL. So we try to get them on the higher side. And then we supplement them for about 3 months and then we recheck again. So those would be the more common, especially if you have an otherwise typically developing child with no other comorbidities. Those would be things that I would do in terms of evaluation.
And you mentioned describing the preemptive awakenings protocol. I'm beyond excited that you published this book. And at the time of this recording, this book is just
Hmm.
coming out. So people can go check it out. You can go online and purchase it. But tell us about your book. What's in the book? Who is it for? And where can people find
Yeah,
it?
no, I am beyond excited too. I'm telling you. So, Beyond Tired is the subtitle is A Sleep Physician's Guide to Solving Your Child's Sleep Problems for Good. And I wrote this book because, like you, I get a lot of questions within my practice. I get questions from friends, neighbors, my followers on social media, emails, asking very similar questions, right? Asking the similar themes. Why is my child not sleeping? Seeing families impacted by their child's poor sleep, seeing kids struggle in school, seeing an uptick in the diagnosis of ADHD and other behavioral issues, many of which are tied to sleep. And also comparing that to the information that's out there, which is incredibly confusing, even for me as a physician. You go on Google or anything else, and there's so much confusion. That's just what I can call it in terms of what's the right thing to do, why, when, and things. And I've also experienced where even well meaning practitioners just are not sure what to do with a child who's struggling with sleep, and families coming to say, oh, I was told my child would outgrow it, and now it's 4 years later, and we have the child on multiple medications for ADHD and anxiety. And then I look back and I think, oh my word, maybe if you knew this 4 years ago, maybe if your doctor knew this, or whoever told you, whoever you went to see knew this, then we would maybe prevent this downstream effect. maybe. And so that was really where that book was coming came from, and also from my own personal journey as someone who has kids, and they struggled with kids with sleep issues, and I struggled with sleep issues as well. And so really it's a detailed guide along the lines of sleep in children. So from what is normal, because before we even recognize what is abnormal, we need to know what is normal. And we don't know what is normal. And so I really go into what are the expectations for different stages and ages of kids to understanding circadian rhythms. We throw that word around a lot, but many people don't understand how powerful it is and how much it is, how important it is in regulating children's sleep, understanding the other physiologic processes that regulate sleep. And then we delve into the different sleep disorders, ranging from behavioral sleep issues, which I've had the opportunity to talk to you about on this platform as well, to the use of supplements. How can you use supplements safely? Should you use them? To medical sleep disorders, sleep apnea, restless leg syndrome, narcolepsy, all of those things. And then I talk about sleeping moms, because that's a group that I'm so passionate about. Women and moms are exhausted, so there's a whole chapter dedicated to them. I also talk about sleeping autism and ADHD and other neurodiverse conditions, because there's just a dearth of the appropriate information. So I'm not, I hope I'm not giving too much away, but it is pretty much, again, a guide to really walk you through. And what I love about it is you can read it from start to finish, or you could just take a chapter that you feel is pertinent to you or to your patient, and just run from there. And we don't just talk about what is going on, we talk about what are the recommendations and how would you go about addressing these issues. In terms of who is it for, personally, I would say for everyone, but specifically for that parent who has a child who has sleep issues, or for that parent who's just curious to say what exactly is appropriate when it comes to sleep. I would also say this book is going to be a fantastic resource for physicians and other healthcare practitioners. So, ranging from the pediatrician to the family medicine doc to the internists to the therapists, psychiatrists. I think because, like you've said so many times, we go through training, but many times during our entire training as physicians in medical school and even after that, maybe 2 hours, even if that, on sleep. And so much less on pediatric sleep. So I think it's a great place to start.
Thank you for writing this book. It's so needed, and I can't wait to get my copy of it. I will be adding this to my resource library as well because, as you were just saying, most of us get very little training in sleep. You and I did sleep
Mm,
medicine fellowships, and so of course we pursued that extra training. But prior to that, it was, yeah, 0 to 2 hours of sleep education. And even though I did a sleep fellowship, I am not comfortable managing
mm,
pediatric sleep disorders. We learned a little bit about pediatric sleep in my
mm.
fellowship, and I get questions about pediatric sleep all the time. And I say, go ask Dr. Funke, go follow her because she's the expert in that arena. Yeah, so I'm really looking forward to adding this book to my collection because I know it's going to be such a valuable resource. So, to you as a practitioner who's listening, add this to your library because it's going to be so helpful for you, even in your personal life, if you've got children in your life, or if you're working with patients and clients who maybe are children or who have children of their own. Where can people find your book?
It's going to be on Amazon. So you could find it on Amazon. We have the hard copy, we have the Kindle version. People are already asking me to do the Audible, but I'm saying one step at a time. But Amazon will be the place to go.
Fantastic. So we were chatting about this a little bit before we started, but I would love to hear how you even found the time to write a book between you running your practice to doing your speaking engagements to taking care of your family. You've got so many things on your plate. And I know a lot of our listeners would be interested as well because we've got sleep coaches, therapists, psychiatrists, primary care physicians, all kinds of health practitioners. And but many of us are working on our careers and we want to have an impact beyond the walls of our
Mm,
clinical practice.
mm.
And you're doing it in such a beautiful
Oh.
way. So could you share some pearls as to how did you make this happen?
So it was a project that was long in the making. Maybe not, people will say maybe not so long. So I've always felt like I had a book in me because I'm a teacher at heart, right? I love to educate and empower people. And so if you follow me on social media or my YouTube channel, you'll see that. So this is almost like a compilation of all of that in an organized fashion. So it was to put the content together was not so hard because I do this all the time. I think to put it together in a way that's organized was a lot of work. And I would say also, even harder was to distill it in such a way that it was relatable. And so I talk about the fact that I'm writing this, and you're gonna see in this book as you read it, and you'll let me know, Dr. Bhopal. It's almost like you feel like you're talking to maybe you have a neighbor who's a doctor, and you guys are just having a conversation. And that was the tone I wanted to carry through it. Not in a way that, of course, yes, I'm the expert, but I wanted to come to people's levels and meet people where they are. That was hard because I had to take somewhat complex concepts and break it down. So I think that was really what was hard. But I would say one of the things that I've learned to do is really ditch imperfection. Like, listen, B plus is good enough. And also the power of delegation. And I realize as a clinician, but also a speaker, that there are lots of things within the work that I do that other people can do, and sometimes they could do it even better. So leaning into my teams, having someone that helps me with emails and some of the more like logistical things so that I can really focus on what I would say is my zone of genius through the power of delegation has been really life changing for me. And I would also say I'm at a point in my life where my kids are now older, so they still need me. They don't know that, but they do. So, of course, I'm still doing a lot of things around family and things. But I would say I kept the focus. And sometimes it's all I could do was, okay, I'm going to give an hour, take my phone out of the room, take every distraction out, and just focus on this. And so that was really building on it. And I started this project, I would say, in January. And so it's not something I did overnight. So you can imagine once you start to add that up, it ends up being a book as long as you don't give up. And so I'm really happy that it's out now.
Thank you for sharing your process and sharing all those really useful tips. Like you said, working in your zone of genius, delegating what you don't have to do. I think as physicians, that can be
Mm,
hard for us to do sometimes because we feel like we need to do everything. But the reality is that we don't. And you can have a much bigger
mm,
impact when you allow others to help you. So I think it's so interesting to hear your process, and the tone of the book is spot on as you just described that it's you're talking to your neighbor
mm.
who's a doctor. I read the sort of the sample, the excerpt, and I was so impressed, and I just love the tone and how it's so accessible and easy to understand. So I'm really looking forward to, like I said, adding this book to my collection and reading it cover to cover because you have so much to share, and I'm just very grateful for you doing the work and for being on this channel
Thank
again.
you so much. I appreciate you. You're part of my story, just so you know. Just the work you do, learning from you, your support is something I definitely appreciate.
Oh, well, thank you, Dr. Funke. And so, again, just to recap, we talked about night terrors, how to assess them, what they are, when to refer. We talked a little bit about that. Check out Dr. Funke's book for more detail and information about how to guide your patients who have children with sleep issues or if they are children struggling with sleep. And where else can people find you, Dr.
So
Funke?
my website is a good place to start. It's restfulsleepmd.com. So just all one word. And also, I'm on Instagram at Restful Sleep MD, and I'm on LinkedIn at Dr. Funke Brown. So, different ways to get in touch with me. And, on my website, you'll find, of course, the link to the book. You'll find the link to my clinic, speaking, and also my blog as well. So, those are just some places to start. I also have a YouTube channel. You could find the link right there as well. It's Dr. Funke Brown, and where I share nuggets as well on sleep in kids.
Amazing. And as we wind down, is there anything you'd like to share with our audience before we wrap up?
I think we've covered a lot today, and I would say keep doing the work you do and because people need it, right? Sometimes we feel, does it even matter? And I can tell you when you learn how to help your patients sleep better or your clients sleep better, you're changing lives because we know the association of poor sleep and all the long consequences, the deleterious consequences. So keep doing this work. Hang out with Dr. Nishi because she has all the gold. And yeah, just and prioritize your own rest because again, it's cliche, but you cannot pour from an empty cup. So when you prioritize your own sleep, it will amaze you how much more you could get done.
Wonderful. Thank you so
Thank
much.
you. Thank you so much.